Hi Andy, this is Dr. Neelima here. I'm a periodontist. I work with Apollo at Jubilee Hills opposite to KBR. So what does the term periodontist mean? So are there different doctors? Branches in dentistry, something which many people don't know. Yes, there are. There are many different branches in dentistry, and one of the branch is periodontics, and I'm a periodontist. So who's a periodontist? What do I deal with? I deal with perio means all around. Dontist means the tooth. Whatever is around the tooth, I deal with all the diseases and the health of all the structures around the tooth. So what is there around the tooth? We have the bone, we have the gums, we have the whole soft tissues, and there's also something called as a periodontal ligament. There are a lot of structures around a tooth. It's not just the tooth sitting there. So one client just asked me, ma'am, other than the jawbone, is there bone around the tooth? Yes, there is. Like the pillars of the house, yes, we have a foundation for the tooth also. It is housed in an individual house, and then it has a periodontal ligament, which is like the what can I say, the so this periodontal ligament is like, suspension of the car. So the good the periodontal ligament is, the happy the tooth is in its house. So there are many structures, there are many liquids, there are many hormones and lot of things which are around the tooth. So periodontics is just not about cleaning of teeth. It involves a lot of science. So what are the problems that we can face around the tooth? So initially it starts off just as, bad breath, and then we ignore it. We think that okay, I'll brush 2 times a day, or let me have a chewing gum, and that is sugar free. And then we think okay, let me drink some water. We try mouthwashes, we do a lot of things, but the bad breath is still there. So there is some reason why you have gotten the bad breath. And that is very simple. It's just because of the deposits that form. The words which here, like tartar, calculus, plaque, you have heard all these terms. So it is because of that which has to be treated and which we ignore because it's painless. And then this proceeds into the next stage of bleeding gums. Yes. And then we think, okay, maybe my brush is harder, maybe I'm brushing too hard, or maybe my vitamins are less. You start taking vitamin C, you start taking vitamin B12, and still it doesn't reduce. You just try to avoid the dentist, is what I can say. So please don't ignore that. That's the next stage. And when we ignore this stage, it leads into the next stage called as gingivitis. What is gingivitis? Gingiva is the soft tissue which is covering the bone. So when the tartar is formed, it houses a lot of bacteria in it, so which the gingiva or the gums, it reacts to it in the form of inflammation. We all know the term inflammation by now. We know that even if we have a cut on the skin or burn or any hurt, your uh, skin swells up. That is called inflammation. It reacts, and there is inflammation because your antibodies are acting to it. So that is the next stage where we still ignore. Some of us, yes, they do go to the dentist and say, I'm having bleeding gums, my gums look swollen. You get your cleaning done, a little bit of deep cleaning, and then everything is okay. Even to that stage, it's fine. And next comes the stage of periodontitis. We call periodontitis a silent disease. Why a silent disease? Because you don't think about pain or anything till 70 to 80% of damage is done to your bone and the gums. You will only come to know after so much of damage is done. That's why we call it a silent disease. But it's not been silent, it's been giving you hints in the form of bleeding gums, in the form of gingivitis. Still, we tend to ignore them. When we ignore a smaller problem, it creates into bigger one, not just dental, any kind of problem. We all know that. So, the similar way here also, it leads to periodontitis. What is periodontitis? Same thing, as I told you, in periodontitis, I deal with the things around the tooth. Same way, this is disease of the structures around the tooth. So in this case, because the plaque or the tartar which is built up, the bacteria, it starts eating away your bone. So your bone is stronger. It stands like this around the tooth and the gums cover them. So imagine when the bone is going low and low when it's being eaten away, where do the gums stand? It has nothing to hold on to. So even your gums start moving down, and that's the most dangerous part of it. As long as your gums are intact and little part of your bone is gone, we have treatments. We can use bone powders, we can still treat them. Even your gums move down a little bit also, we have treatments for that. But more than 60-70% of the damage done to the bone or your gums, your prognosis becomes weaker. It is a problem. So please don't ignore any of the symptoms which you see in your oral cavity. Please do visit a dentist. Yearly once, visiting a dentist for simple cleaning procedure and getting it checked can prevent a lot of disease. Don't let it progress till the stage of periodontitis. We have newer treatments like laser treatment, lot of treatments, but with any kind of treatment, probably it is painless, healing is faster, but we cannot reverse the damage which is done in most of the cases. In few cases, yes, we still can do treatments. But why to go to such a stage when you can prevent it or stop it at the initial stages? So please go to the dentist yearly once, get a simple cleaning done. Thank you so much. We'll be back soon with a new video. Thank you.